So Dr. Belmaker, you've given us a lot of really great information about what is bipolar and who gets it and the different aspects of the illness. Tell us a bit about the diagnosis. You mentioned that it can be not so straightforward and a tricky thing, so maybe you could share something about diagnosis of bipolar.
Well, it's important for me to say that there are no x-rays today to diagnose it, and not even more sophisticated brain scans like PET scans or MRI. There are many research articles that find differences between groups of 100 bipolar patients and 100 people without bipolar disease. But it's very important that people understand that those are differences on the average. And there is no finding that can allow us to diagnose bipolar disorder other than by taking the history. And it is also important to know that the history from the patient is almost never enough. We must, as psychiatrists, invite the family. And some patients find that uncomfortable. And sometimes the law isn't completely clear as to patients' right to privacy. When there is a clear danger of mania, in most states and most countries, and according to what I see as good medical practice, we must find a way to involve the family and get a history. Of course, there are some places where medical records are electronic, and we can know what our patient might have been hospitalized somewhere else, but that is not yet the case everywhere, and the best way to find out is by interviewing a family member, best with the consent of the patient, but we must try to convince him of that. Not every patient realizes how important it is for us to hear from the environment. And on that basis, we make a diagnosis. If the diagnosis is not definite, but the suffering is clear, it is often worthwhile to try a mood stabilizer, a treatment for bipolar disorder, and see if it helps. If there is a question of bipolar disorder, a single visit to a psychiatrist and a prescription is never enough. There has to be follow-up. If it's a new patient, perhaps once a week. If it's a patient that you know very well and that is stable, perhaps once a month. But no patient should think that he can come to a psychiatrist, get a diagnosis, a prescription, and then not be seen again. That's an illusion that is unfortunately dangerous for patients, and the public needs to know that the world needs medical care systems where there is follow-up and where people feel comfortable coming back. And so a trial of a mood stabilizer, if there's a question, after a few visits, the patient and the physician will know if this is helping, and that would strengthen the diagnosis of bipolar disorder.
Very interesting. So it's really a clinical diagnosis that the psychiatrist has to make, and they really do need good information, both from the patient and from the system, be it the family or work environment or other people who have other observations. Very interesting.